Assalamu alaikum viewers, this is Dr. Khawaja Sajid. I'm one of the orthopedic surgeons. I do hip and knee replacements, arthroscopies, fractures and tumors. Today the public awareness program is about knee infection in adults. It's not very uncommon thing actually, but this is one of those diseases or sicknesses or problems which are most commonly missed by general practitioners, by general surgeons, or even some junior orthopedic surgeons as well. In some countries where the general surgeon, they also practice the orthopedic. There are only few countries left where there is no subspecialties, but nowadays all over the world there are subspecialties or specialties. So people, they go, if they know their problem with the bones, they go to orthopedic surgeon. So most of the time these things are missed. So that's why we are doing this public awareness program, to give more and more awareness to the people, that they shall know as well that what's going on with their joint. The most common joints which got infected in adults is knee joint and hip joint, the big joints. Very rare they get the infection of the wrist or elbow, shoulder or ankle or other joint, but the most common affected joints are the knee and the hip. These joints infections are most common in extreme age groups. Either the child is very young, like 1 day old, 2 days old, a week old, or the adult who is very old, for example 85, 90 years old. In those extreme age groups, the infection of the joint is very common. And that's one of the reasons as well, that because most of the time is missed, because small child 1 day old, of course, cannot express his pain, cannot express his feelings, his symptoms. So people, it's easy to miss that by the parents or by the doctors as well. And same as old people, they prefer to lay down. 85, 90 years old, very few people, they are mobilized, so they prefer to lay down on the bed. So they just stay there, and family and patient himself ignore, and they actually is missed. The results are devastating. Joint infection is one of the worst thing in orthopedic, I would say, because this is one of those few emergencies in orthopedic which shall be treated as soon as possible. Otherwise, the results are very bad. Very quickly, the bacteria, they eat the cartilage in the joint, and then very quickly they get the arthritis. I mean, I would say it's worse in very young children, for example, 1 day or 2 days old child, because he has his whole lifespan to live with that. But 95 years old, maybe you can say that even the cartilage is damaged, may not be much effect. But the problem is not only the cartilage damage. These patients can go into septicemia, and above all is pain. Even though old patients or very young, they cannot express, but they feel. Pain is a subjective feeling. They feel the pain. Child will keep on crying, and old patient will keep on lying, and he will not move. He will not eat. He will not go for toilet or washing or at all. So that's very important thing. The take-home message, I mean, why we're doing this program for the general public who are not related to medicine. If any doctor gave you painkiller and within 12 hours you think swelling is not subsided or pain is not going off, or the child or the old patient is not moving his limbs, you have to go to orthopedic surgeon. You have to change your doctor. You have to go to the same doctor and discuss again. That's very important thing, because it's one of the emergency in orthopedic, one of the urgent thing to deal with. That's what I'm saying about. The small child is very easy. For example, when the mother is changing the nappy, you make the child naked and he is lying on the bed or nappy changing board, and mother observe that he is moving one limb and not moving the other limb, not moving the other leg, or even when the mother try to pull it to clean it and child is crying excessively. That is one of the thing, either the problem with the knee or the hip. Knee joint, easily you can say, because it is very apparent, you can see the swelling, you can see the redness, but the hip joint you can't see, because it's quite deep and does not give swelling or redness. But the movements are much restricted. Movements, when you try to pull slightly, child will cry or old patient will cry. So these are one of the things. Then old patient, you can also suspect fracture, even though you are not witness that he has a fall. But that's a very important thing. The important thing is to take them to hospital. The take-home message for this program is not neglected. Take to the specialist. Take the child or old person to an orthopedic specialist or who can diagnose this problem. And if you don't get better within 12 hours, within 24 hours, change the doctor or discuss with the same doctor again. Don't neglect it, because the results are not good afterwards. Take care of yourself and your family. On display is my contact number. If you want to contact me or discuss, you're welcome. Thank you.